So the Specialist Mental Health Assessment Hub here in Kerry is aimed at offering appointments on a single referral system for GPs in Kerry. We offer a same-day assessment for any client that needs to be assessed, and our referrals come directly from GPs. Here in the hub we have an appointment system where GPs can directly refer clients to the hub, and we offer them appointments. We rate the appointments depending on the assessment we receive from the GPs. However, on a daily basis we have emergency slots available, and this main aim of this is to divert people from the ED. We can see if we receive a referral in the morning from a GP, we can discuss it with them and offer an emergency referral straight away.
People can be suicidal, they can be having symptoms of psychosis, they can be depressed. It varies considerably. But we have the flexibility that if there is an emergency, then we can see the patient that day. It's a service we provide to the GPs so that they're not waiting on a long wait, let's say, to be assessed by a psychiatrist. Referral to the hub means that the patients are not going to be waiting in the emergency room for extensive periods of time like they normally would without our service. And the patients really like that. The GPs like it too, because they can get a patient seen that day or the next, whichever is appropriate.
I'm a clinical nurse specialist and I undertake initial mental health assessments of service users referred here. So when a service user comes into me, generally they would spend an hour to an hour and a half with me, where we would go through their presenting problem just to figure out what's going on for them. And then I would also look at the physical health. I do a complete physical health assessment and look at the social aspects.
So I work with the community teams as a crisis intervention nurse, and my role would be with Castleinane and Dinglety. If the GP would refer somebody in from any of those areas, which is my catchment area, I would see them here in the assessment unit, do the full assessment, risk, and maintain that link then while they'd be referred on to the community mental health team if they're in a crisis, or they've already maintained a link with somebody from the team through meeting me here in the hub.
A person comes in, they have their mental health assessment, and the treatment outcomes could involve one of the following. That could be a referral on to the community mental health team, and the community mental health teams will consist of a psychiatrist, psychologist, crisis nurses, community mental health nurses, occupational therapists and nurse therapists. There is also signposting to counselling services such as Southwest Counselling, Jigsaw, GP liaison services, or the local family resource centres as well provide quite an awful lot of services. There is also further assessment outcomes would include, on the rare occasion, admission to the local mental health unit, which we would facilitate.
The service is geared towards GPs really. GPs can send us referrals either through HealthLink, or they can call the hub or call me directly, and I would be more than happy to discuss the situation with them. The hub is a fantastic service. The GPs have direct access to a consultant psychiatrist.
So we'd like to encourage all the GPs in Kerry at any time at all to contact us here in the hub if they need any support or if they would like to send us a referral.